we should start with at least an introduction, right? So let's start with you, Dr. Shandley. Introduce yourself. Tell me a little bit about yourself.
I'm Lisa Shandley. I'm a third-year resident. I've been at Emory for 7 years now. I was a medical student here. I did a master's here, and I stayed for residency, so been here for a while. I'm originally from Chicago. My whole family is there, so I'm the one explant from the family, but got a lot of support from them there, and I'm excited to continue to be in Atlanta. I have a family here from med school. A lot of people stayed, so let's see. I'm interested in pursuing a fellowship in reproductive endocrinology and infertility, and I'm excited for the light at the end of the tunnel of residency with a little under 2 years left. So
that's great. That's great. You, Dr. Figueira?
So my name is Stephanie Figueira. I was originally born and raised in Brazil, moved to the United States when I was about 12 years old. And Boca Raton, Florida has been home since. I went to undergrad at Florida State, stayed for medical school, and have been an intern for all of 3 months now. Always wanted to move to the Atlanta area, really liked the city, and always thought that Emory just had a great program, and it was my top choice. I'm very happy to be here.
That's great. That's really great. So I think that's the perfect segue to ask one of the questions that we always want to ask, which is why Emory? Why did you choose to come here?
Sure. Because I was here for 5 years before starting residency, I felt like I had a good idea of what the program was like. I really enjoyed the people. For me, what really drew me to residency here was the current residents. I felt like everybody was, very positive, very fun, and kind of at their same stage of life that I was at. There were other programs that I liked when I interviewed, but I felt like their primary network of people was going to be somewhere outside of residency, whether it was more family focused or whether it was more like they were in New York City and that was their basis for their social group outside of residency. And I kind of wanted a residency program that had a good mix of everything. And I felt like Emory was supportive of people that wanted to have families, but there were plenty of younger or single or partnered but not yet married, and felt like their social circle was primarily their resident class. So that was one really big thing that drew me here.
So I did a rotation here as a visiting student, my 4th year of medical school, with the reproductive endocrinologists and infertility specialists. And during my time here, I just got to observe the residents interacting with each other. And I think we truly treat each other like family here. And we're very close. And everybody just has this really amazing sense of humor. And it just makes a world of a difference when you're in a hard residency to have people that are surrounding you, that are keeping things light, that at the end of the hard day that you're still able to laugh with each other. And that's kind of what I saw here as a visiting student. And then I had the pleasure of working with some faculty that became very quickly invested in me and in my future and kept in touch with me even after I left. And I think that I really saw how much the faculty are invested in the residents here, and I think that makes a world of a difference.
And I think that's been a reoccurring theme in some of the conversations that we've had, the role that faculty play, certainly as mentors or as teachers. And I'm interested to hear from you sort of what your thoughts are on how the faculty are sort of guiding this residency training process for you all and sort of what value they're bringing to you.
Sure. So my time here has been limited, right? I've only been here for 3 months, but I can talk a little bit about my experience so far. So beginning as a 4th year, I kept in touch with Dr. Kawas, Dr. Hip from the REI department, and they were always just great people to guide me on how to choose a residency program. I'm interested in a fellowship. So what are some things that I need to look for in a residency program if I am to succeed in pursuing a future fellowship? And then since starting, I think all the faculty are just really amazing. Dr. Davenport as the associate program director, Dr. Risk as the other associate program director. They just provide a lot of support for us as incoming interns who are still trying to figure out how to balance, the work-life thing, how to just deal with the stressors of learning how to become a doctor. I think first year is really for how do you learn to be a doctor. And I think all the faculty have been incredibly supportive and just being there for us. It's been a really great experience.
Yeah, I agree. I think that one thing that I really liked about Emory's program with regards to the faculty was the fact that the faculty is very diverse in background, in their own educational background, personal background, in what they choose to focus on or pursue. And I found that that was really important for me. I think it's really important in residency to have mentors for different things. Of course, it's lovely if you find one mentor that is someone who can guide you through multiple different aspects of residency and your career and life, but there might be one person that affords one specific thing. So I find that because there is such a great diversity at Emory of amongst the faculty, that I've been able to find research mentors and career mentors and people who I just look up to in the way that they practice clinical medicine. And I think that it's really admirable, and I want to model myself like them in the future. So I think that that's one thing that was special about Emory, in that there's such a breadth of people you can choose from. I think it was also important to me to find other residents that I could look to as mentors. Yes. I know that we work very closely when we're at Grady. The first-year interns work very closely with the third-year residents, and so you get to work very closely with whoever your third year on labor is at Grady. And we used to, back in the day, we had a nights rotation as an intern at Grady, so you had pretty much exposure to two third years who were primarily your go-to person that taught you labor and taught you how to deliver a baby. And I thought that was really important to have that resident mentorship as well.
Yeah, I'm going to piggyback off of that. And I definitely agree. Being at Grady right now on labor, my third year is pretty much who I look up to. And it's so nice to see that 2 years from now, I will know as much as she knows. And it's great to see how far she's come since being an intern. And I definitely really like how big our team is at Grady and how we're just always together. The fourth and third years are always teaching the intern and the second years. And it's just a really great atmosphere to learn in, to learn from your upper levels. It's always nice to learn from your attendings, but your upper levels were just where you are now, not so long ago. And so they understand what it's like to work 12, 13 hours a day, to be tired, but to still have the stamina to learn. So I think it's really great how it's done at Grady specifically.
Yeah. And not only the residents, but we've talked a lot about how the Emory OBGYN department in general is growing very rapidly, and that's great. And one of the awesome things they've done is they've hired a lot of junior faculty or younger faculty, and so people who are not that far out of residency who still remember, what is an effective way to teach to somebody who you have to baseline assume knows nothing other than the ability to learn. So that's been really awesome too, is working with young faculty who they might be right out of residency, right out of fellowship. But, are in an attending position now as well.
Yeah, definitely.
Yeah, and one of the things that I think is so interesting about our department is you're able to see how relationships develop over the course of 3 or 4 years, and specifically to see how the department sort of fosters an environment where, as you said, senior residents can sort of partner with interns and sort of teach from that perspective. And so I think that that's a really great segue into talking about sort of the way Emory is building you all to be leaders. I think that that's something that we endeavor to do, whatever leadership means to you. And so I'm interested to hear from you. Is there something that you feel specific the department or the program itself is doing to create you all as sort of leaders in your field, or to create that sort of trajectory for you?
I think one of the things that they do well is they give you the freedom to pursue your interests. no one person is going to be an expert in everything that they try to do. So the things that you want to pursue and want to become more knowledgeable about and become an expert in, you have the freedom to do that. I know that Emory has facilitated, for myself, I've been able to go to multiple conferences to present research because I'm very interested in partaking in research in my career in the long term. So I feel like they've been good about facilitating that those opportunities. In terms of leadership, I know that there are a lot of ways that they try to facilitate mentorship and leadership groups. We have faculty mentor groups where there's a faculty member who is assigned a group of 4 residents, one from each year. And they're kind of in charge of getting the group together and making sure that everybody has a kind of a home base that they can go to if they're still trying to figure out their own mentors in their career, or trying to even figure out what their career, might look like in the future, or trying to figure out, what they want to do in life. So it's nice that they facilitate that and leads to kind of group roles that people can take different leaderships within.
Yeah, that's really great. And I guess that's a great place to talk about your mentor groups. So I love seeing the pictures from mentor groups or hearing about some of the activities that you all are doing. So I'm interested, what's been some of your favorite mentor group activities so far?
Who's in your group?
So Dr. Childress is the attending,
she's
she's amazing.
Yes.
She's our pediatric gynecologist. And then it's me, Rachel McDeal, Kaylee Vinson, and Mina Farazad.
Okay.
So it's a really fun group. We've only met once so far because we just switched mentor groups. It used to be Dr. Haddad, but she unfortunately stepped down. But we met at Dr. Childress's house and just had like a pizza party with some wine after work, and it was great. And everyone in the group just has like really funny personalities, but they're all individually different, and it was great.
We also just got a new mentor. Dr. Kelly became our group mentor. It's me, Naz Yang, and Lauren Rouleau. And he had us over to dinner to their house. He and his wife cooked for us, which was lovely. And we decided that we publicly challenged one of the other mentor groups to some sort of sporting event, mostly a bowling tournament, I think was what was called out. So we challenged Dr. Hill's group because they're very active on social media whenever they get together. So we're trying to one-up them. But to be determined who wins.
To be determined. Okay, very good.
Check in for conversations part 2.
Right. Well, and I think that, the mentor groups obviously provide you a way to sort of informally meet with faculty and your colleagues. But then also I would assume that it's a really great way to try to create some balance, some work-life balance. And I know that that's something that we as a department focus on, like the idea of being a well-rounded physician, like really focusing on trying to create balance. So I'm interested, you're sort of at the beginning of that, and you're sort of moving towards the end of that. I'm interested to hear how you're establishing that type of balance between work and personal life, if you found it. Any secrets?
So I can start, and then Lisa can say how she was able to find it after 2 years. As an intern, it's definitely difficult. You're still readjusting to working, 80-hour weeks, which is new. We definitely did not do that in medical school. And you're just adjusting to stepping into this role of being a physician, to taking care of patients. So it is a really big and tough transition period, definitely. I think that the way that I found some type of balance is to keep in touch with friends and family. They keep me grounded. I always call someone on the way home from work just to hear something that's not medicine related. And then I have a boyfriend who's incredibly supportive. He's a second-year resident at Emory as well in another specialty. And then when you have time off, even though we're all tired and exhausted and could really use some sleep, it's really important that you kind of push through that and still meet up with friends and still work out and still go to the gym and just do normal things. It's difficult, but it's really important to just keep you in the right positive mind space.
I think work-life balance is always a work in progress, and it changes how you accomplish that throughout residency. I think intern year is hard because you're you know nothing, and you're in this weird juxtaposition where you are probably at the peak of your general medical knowledge, having graduated medical school, but you know nothing about the logistics of being a doctor or working in a hospital and actually taking care of people and being the primary person to do that. So it's a hard position to be in. The hours are long as an intern. You do a lot of the grind work. But it's actually very fun, and I actually found intern year to be very fun. I really thought it was rewarding, and it was affirming for what I had chosen to do. Second year is tough in our program in particular, just because you have a couple tough rotations that are very active, where you leave work physically exhausted. I mean, labor, you always leave work physically exhausted just from running around. But so second year is tough, and I felt like second year was actually harder to find work-life balance. It's also weirdly better than intern year because people actually care what your opinion is when you evaluate a patient. Like, you're not just an intern anymore. And that happens literally within a week's time of going from the end of June, when you're an intern at the end of your first year, to a second year where it's your first week, and all of a sudden people are like, oh, what do you think about this patient? So, I don't know how much that week makes a difference, but it's better because you're more involved and you have more accountability for your patients. But it's tough. I think that starting third year has caused me to circle back and try to regain a little of what was lost in work-life balance second year. And for me, it's really about setting goals and making a schedule, including scheduling in personal time outside of work, time on activities that I want to do. I'm a big goal setter, little goals. And so one of my goals was to just get back into shape in general and be more active, because I let that go second year. So me and one of my other co-residents signed up to do a half marathon, and it is forcing us to train. So it's happening. But so that's, there's little things you can do that over the long time make a big difference.
For me, I look way ahead of time in my schedule and see when I have full weekends off, and try to plan little vacations here and there, get out of Atlanta, do something different. This weekend we're going to the mountains, so different atmosphere. I think it's really important to kind of get away and recoup, and then come back and continue to work hard.
Well, and I think that one of the things that I have noticed whenever we sort of start talking about work-life balance, to your point, which is that it's not necessarily balanced all the time, right? Like, you try to sort of mitigate between sort of times where you can't really focus on personal and then try to recoup that in some sort of way. I'm interested to know what your thoughts are about the department's focus on wellness, because we have sort of, I would say, one of the most robust wellness sort of initiatives led by Dr. Hill and the Wellness Committee, and sort of how you're finding value with that. I know we just started something where you have a Wednesday that's dedicated to wellness. Tell me a little bit about that, and has it started yet, and if you guys are finding value in it.
I've definitely noticed a change in the focus on wellness over the past 2.5 years. Initially, I felt like there were, maybe this was the beginning of intern year, middle of intern year, we'd have a couple lectures about wellness and the importance of sleep, and you're just sitting there being like, well, I could have slept in an hour rather than coming to this lecture.
My thoughts exactly.
Yeah.
Yep.
But I think that has really changed. Last year, they implemented about 3 times a year, they'd give you a wellness afternoon or a wellness morning, where you basically were relieved of clinical duties for that afternoon or morning, so that you could do normal people things that have to happen during business hours, but you can never get them done, like go to the dentist and get your car fixed. And so it was really lovely last year, and they got some feedback this year that, that was great. And, if that could be facilitated to make sure that could continue to happen, it would be lovely. They've actually changed it so we get more wellness mornings off. Every Wednesday morning we get protected time for education, and they've scheduled one of those education mornings out of each rotation block to be a wellness morning, where we're kind of free to go after grand rounds, and you have free time during like a normal morning to make appointments as you need to, and it's been really lovely.
Awesome.
Definitely.
It's really good.
I agree. We've only had one so far. It was last week. But it's nice to have at least a couple hours during regular working hours where you can get things accomplished, like for example, go to your annual OBGYN appointment as an OBGYN.
It's true.
So it's been great.
Well, and one of the things that I've noticed sort of happening over the past year is to really see the wellness initiative sort of like sparking other discussions, right, about like how to balance this whole work thing with like what are my future goals, and like so that you can have the clarity of thought to actually like plan ahead. And so I'm interested to know, you're sort of at the beginning, and I would say that where you are, there's definitely some distance there, but when you're looking ahead to the future of like what does the end of residency look like, and sort of the trajectory of my career, what are you interested in, or do you have some definitive thoughts about what your future is going to look like, and how is the department sort of facilitating that?
So I'll start. I have a feeling that Dr. Shandley and I have very similar kind of career goals. Just so happened that we got paired together to do this. So I came into residency being about 90% sure that I want to pursue a fellowship in reproductive endocrinology and infertility. And so that's my main goal. I have faculty members in that department that have been extremely helpful and that have set me up for success. Whether that means involving me in research or involving me in future projects and publications, they're extremely supportive and very invested in my success, which is really nice to know that you have someone there for you and who you can always talk to. So my goal for now is it's hard to picture my future beyond fellowship. As an intern, that's kind of like the main goal right now. I think maybe Lisa has already thought ahead of that, but
it's true. The farther you get, the more you realize that what you thought was the end game is not the end game. I've known I wanted to go into medicine since I was very young, and so going to medical school was always the goal. And then I got there and I realized, like I have to pick what I want to do. I wasn't by any means surprised when I chose OBGYN. And at that point, I had some research experience and thought I was interested in getting at least more experience. So I did a master's in clinical research, during which I did a project in it was infertility in cancer survivors. And so I really enjoyed my time and got to know more about the field of reproductive endocrinology and infertility, and had no experience at that time about in a clinical sense for I didn't know if I'd like being in clinic more frequently than the OR. I had originally thought I wanted to do general surgery when I started medical school. So after the second year rotation through the REI rotation, and I just loved every minute of it. It kind of sold me on that. I do think I want to do research as part of my future career, and I've always kind of seen myself in academics. So that continues to be my trajectory at this point, and who knows if it'll change. You think about, I want to do fellowship, I think I want to be in academics, but you have to, at some point apply for your first job, and that's something that's new frontier to you now when you're like 34 years old, and everyone else has been well on their way in their careers, and you're 34 and applying for your first job. So who knows? It's an evolving process, but that's currently the plan.
Well, I want to pivot just a little bit, because I'm always interested to hear sort of like what your typical day is like, keeping in mind that there's no typical day. Like I can certainly appreciate at this point, but I'm really interested to know sort of like, what does a typical day look like for each of you?
Okay, so I think it's really rotation dependent.
Yes.
Right? So our schedules are it really depends on what rotation you're on. The schedule is set up in a way that if you have a hard rotation, your next rotation is usually a little bit lighter, which is nice. I can give you what a typical day is on Grady labor. So a typical day, let's say I wake up around 5 a.m., get to Grady about 6, round on some postpartum patients, and then sign out is usually at 7:30. So sign out, everybody gets together in the night team and the day team, and the night team signs out the patients that they had overnight to the day team. And the attendings are usually present as well. That way, everybody's on the same page about the patients on the floor, and everybody's aware of any workup that needs to be followed up or anything like any laboring patients, things like that. And then through the day, the job of the labor intern, which is my role, is mostly to do triage for the what we call viable patients. So pregnant women that are 24 weeks or farther along in their pregnancy, and then to also carry the postpartum phone, which tends to ring about 10 to 15 times a day. And that's pretty much the role of the labor intern. And then, of course, if there are any vaginal deliveries, then I participate in those. And usually sign out in the evening is about 6 o'clock. And I'm usually there until about 7:30, finishing up some notes. And then I go home, eat, sleep, and do it all over again the next day.
Rinse and repeat.
Yes.
Yeah. Grady labor is one of the more time-intensive rotations. I'm clinic chief right now, so I've got a pretty sweet gig going on. I show up at Grady at 8 a.m. and partake in clinic all day, and then I go home around 5 p.m. So marathon training is going great, but for a half marathon. But the typical rotation, third year, the good thing about our schedules third year is we do a lot more surgery. First year is about half surgery, half OB, and then second year is very obstetrics heavy. You have a lot of rotations at Midtown where they have high volume deliveries. You have 3 rotations there, and then you have a rotation at Grady as the nights person for labor. So it's a lot of obstetrics second year. So this year it's actually been lovely because we have more time in the OR doing GYN. A typical GYN rotation, you'll get to the hospital probably around 6 o'clock to round on your patients, and then make sure you prepare your patients that are going to the operating room that day and spend most of the day in the operating room. And if there are any patients that come through the emergency department that need to be seen by your team, also get staffed by the team. So it's exciting third year. You kind of shift to do a little, third and fourth year, you shift to do a little bit more of the gynecology and the surgical aspect of it as opposed to just obstetrics.
Yeah. Mm-hmm. And what I really like about our program is that even as an intern, I had gynecology as my first rotation. And we jump right in and start operating really early one-on-one with our attendings, which is really great. And so when I was on my GYN rotation at Midtown, I would have anywhere between maybe 5 to 7 cases a week that I would be operating one-on-one with attendings. So that's really fun. Getting a ton of OR time so early on in your intern year is, I think, really awesome about our program.
Mm-hmm. I think that's a credit to our program as well, that there is an emphasis on providing you the opportunities to develop your clinical skills, right? Starting from the very beginning, obviously at appropriate levels for your skill set. So I think that is something that I've heard as a reoccurring theme that is really a benefit to our program. I know that one of the things that I'm always interested to hear is sort of, if you are, since you're in it right now, do you have any sort of advice or words of wisdom for those who are looking to enter into residency? I would say right now is probably the time where there's a lot of like information gathering, right, from prospective residents. And so do you have any sort of like tips or ideas about what to expect or how to manage the resident experience?
Yeah, so I'll speak to that a little bit because I, again, was just an applicant not that long ago. And looking back this time last year, I was submitting my applications to residency, which is crazy to think that was just last year. But I remember that I came up with this crazy Excel spreadsheet of all these stats of all these different programs, and I ranked the programs, like I gave like little numeric things to different things that the programs had. But when it came down to it, it really was the gut feeling that I felt on interview day. I think residency is hard no matter where you go, and it's really important for you to surround yourself with people that are. The people here are just so amazing, and they're so supportive. And even though we work hard and sometimes the day is really long, it's really nice to be able to laugh with your coworkers, to keep things light. And even though I've only been here for, 3 months now, I feel like I've already formed like really close relationships and bonds with my coworkers. And that's what keeps you going. Even though the days are long and it can be hard, it's still an amazing learning experience. I'm really grateful that I'm here. I'm really grateful that I get to take care of a patient population that is disadvantaged, unrepresented, like the patients at Grady. And so overall, it's been great. And I think that for people that are looking and applying to residency right now, trust your gut feeling when you interview at the programs. That's usually the cue.
Yeah, I agree. And I also, this is probably not just for applicants, but also for first and second years, because those are the hardest years of residency, I think, and at most programs and at our program. But I think it's really important to keep things in perspective and to keep in mind that residency is a finite period of time. And regardless of what specialty you go into, regardless of what program you're at, there are times that just absolutely suck. But then there are so many times that are absolutely so rewarding, both for personal growth and then also for what you're able to do for your patients. You also do build relationships in residency, unlike anything else people get from other forms of coworkers. My partner is not in medicine, and he's like constantly amazed at like how I interact with my coworkers. And he's like, "These are people you work with," and I'm like, "Yeah, but like it's residency." And so it really is a very unique setting that people that you get to spend some of the most formative years of your life in. I think it is important to take time to reflect in whatever manner that is, for each person, whether you're someone that likes to talk with family outside of medicine or friends outside of medicine, and that helps you dial it back, or whether you're someone who likes to meditate or do yoga or do, whatever you need to do to reflect is important to keep things in perspective, because you can get lost in the days and the weeks, but I promise you the years go so fast. And before you know it, you're like, I'm going to be in less than a year applying for fellowship. That's crazy to me. So yeah, it goes by very quickly.
And I think one of the sort of a great place to end the conversation on is to talk about some of those relationships that you've developed in residency. I think just listening, I'm interested to know, what do you think contributes to solidifying such strong relationships in residency? Is it the nature of the work that you're doing? Is it the number of hours? Is it some combination of both? Because I do hear that a lot, that there is something special about that process that sort of develops these types of lifelong relationships. What do you think it is?
I think this is not unique to residency, but any time that you have a shared experience with somebody where you don't have to talk about what it was that you mutually shared that made it special, can create a really strong bond. And I think that that's constantly happening in residency. It's like the perfect setup for that. So, I feel like I've also gotten closer to my friends who are in different specialties at Emory, who stayed for residency that I know from medical school, and even just being able to either commiserate or celebrate with them in their successes has been interesting, and I think there's value both in having people with a very same perspective where you can talk with someone about an issue or an experience and they know exactly where you're coming from. And then I also think there's value in the people who are just far enough removed that they can sympathize but maybe not empathize. So I think it's important to have people of both respects. But I think it's just that you grow so much as a person during residency. And it was funny, my whole family's in medicine. My grandpa was a surgeon. He was probably the first person to enter medicine. And my grandma always said, never get married before you're 30, because if you're going into medicine, you're going to change so much in residency. And I think it really is true, just because you really grow as a person and you find not only who you are, but what you like and where you want to go in life. And I think that that's really important. And you have, 35 other people in the residency program that are also figuring those things out about themselves and growing with you. So, yeah.
Yeah, I agree. And I also think it's a little bit also the nature of our specialty. I think OBGYN is usually the highs are really high, right? Delivering babies and all of that. But the lows can be very, very low when you have bad outcomes. And I think when you share those experiences with your co-residents, it just forms this really tight bond when you go through something like that together. And I think that's partly what makes us so close and tight-knit, is having to go through bad outcomes together.
Yeah, that's such great information to have. And I think I'm always impressed by sort of how you all are able to balance the highs and the lows. And I hear that from the faculty. I hear that from the residents as well. And so I think that it's evident to see, at least from my perspective as an outsider, how rewarding you all find the work that you're doing. And so hopefully we've been able to capture that a little bit here today. And I'm hopeful that it will spark some other conversations about sort of women's health in sort of broadly, and then our Emory program and sort of its fit in all of that. I have one last question, and I'm always wanting to ask this particular question when I have women physicians. So as a woman in medicine, is there anything that you're particularly excited about for the field? Is there anything that you yourself are especially passionate about that may be directly correlative to you being a woman in medicine? I'm always interested to ask that question. And maybe there's no answer to it, but I'm always fascinated.
That's a hard one. There are lots of things I'm excited about, but I'm trying to put kind of like I think one thing that I'm actually personally very excited about is having Dr. Jamieson as our chair. I was very excited when she joined faculty 2 years ago and came back from CDC and came back full-time to Emory, I should say, because she's always kind of been adjunctly affiliated. But having a female chair of the department, I think, will go far. She had a great ground rounds a few weeks ago where she talked about how exciting it is that, more women are in medicine, particularly in OBGYN. The majority of people entering OBGYN are women. And I thought that was really great to point out. But she also did point out that we do have room to make improvements in terms of leadership. And I think that both in pointing that out and then in serving as an example of the head of a department that is a very strong, growing department will be like a really exciting thing, both for Emory, but just in general also for having more women in positions of decision-making and in positions of power within departments.
Yeah, that's really great.
Mm-hmm.
I think that since rotating at Grady, I think that there was a little spark in me to become an advocate for women's health, seeing the women, the patients that we see at Grady. They typically have multiple medical conditions. They don't have good access to health. So when they do come, they're usually very sick. African American women are by nature at an increased risk for having high blood pressure in pregnancy. And so dealing with the complexities that we deal with at Grady and all these complex patients kind of created a spark in me to become an advocate for women's health. I think that our clinic in Grady and our teen clinic specifically, they serve a really great role in providing care for the women of Atlanta. Seeing 15, 16-year-olds that are pregnant just really pushes me to advocate for contraception, to make sure that these women have access to contraception, have access to our teen clinic. And so I'm really excited to kind of get more involved and do what I can to better their health.
And I think to your point, and to both of your points, I think our department is such a great example of having strong voices that are advocating, right? I always am amazed by the strength of the narrative that's coming from our various different specialties. You mentioned the teen clinic. And so when I hear that, I think about how passionately Dr. Kotke and her team is advocating. And the same thing with Dr. Spencer and Dr. Kawas when you talk about REI. So I think that is something that maybe is not necessarily unique to our program. I think a lot of programs would feel that way, but it's certainly something special about Emory as well.
I definitely feel also like Emory, not only within the department, but within Georgia's women health in the state of Georgia in general. I just recently came back from the Georgia OBGYN Society meeting and getting to see the great representation that Emory had. We did this little picture afterwards where it was Emory faculty, recently graduated residents, and pretty much anybody that had been associated with Emory. And it was this huge group that I was like, where did all these people come from? This is half the conference. So it was lovely to see how many people trained at Emory, had some sort of affiliation with Emory, and then stayed within the state of Georgia to really help Georgia's women, given that, we have some of the highest maternal morbidity and mortality rates within the country. There are really people trying to make a change in that, and I think that Emory is taking a huge part in trying to do something to help that.
Yeah, that's great. Well, thank you guys so much for spending time with me this morning. I love listening to your conversation. I love feeling as though we are learning more. I feel like I'm learning more, certainly. So thank you all so much for spending the morning with us, and hopefully you're able to sort of take this morning of reflection throughout the rest of your day as you're rounding on patients, et cetera, throughout the rest of your day. So thank you so much.
Thank you.
Thank you.